Hi, this is Derek Fernandez. Today we're going to be talking to Puneet Desai, the CEO and co-founder of Welcome Cure. They have come up with this amazing technology by the name of Nidan AI. Yes, AI. Even I'm surprised and I'm curious, how is this AI technology going to be helping us in our day-to-day lives? How is it going to change the medical fraternity? How is it going to be impacting everything? Let's take all the knowledge, ask him all the questions about the product, and let's try to understand how helpful this product is going to be to us. So, hi Puneet, it's really great to have you over here. Today we are going to ask you a lot of questions regarding the AI that you have developed and what is Nidan AI. So, let's hear it from you. What knowledge can you give our viewers and how it's going to revolutionize the entire fraternity? All right, so let's begin with the questions if you are comfortable.
Sure, lovely. So great, Derek. Nice to be here today on this podcast, and I am equally excited to share as much knowledge as I can about this cutting edge technology that we are launching from the house of Welcome Cure, which is Nidan AI. And as the word rightly says, that it's a AI tool, it's a AI solution. Before I kind of dig in very deep as to what this solution does, answering your first question, that what is it, if I have to see it on a helicopter view idea and a very layman's language. So friends, first and foremost, most of you would know it, but for those who don't, just quickly I would like to begin with the fact that overall Welcome Cure as an organization, as a brand, this has been the brainchild of Dr. Jawar Shah, and he has been a pioneer in kind of developing technology tools and solutions for the medical fraternity. A lot he's done for the Ayush stream and for the homeopaths in particular. And this is the same entity, this is the same technology solution provider group which has given great products like the Homepath software. Today we have the Homepath Zomeo software present in about 145 plus countries, and 100,000 plus doctors use it, and it helps them find right remedies in their practice and really is a great support system. Then there is also the Firefly mobile application. So we've always been involved in kind of developing cutting edge technologies which have been, I would like to say and take the liberty, a bit ahead of time, and most importantly something which has always empowered doctors, the care providers, the medical fraternity. Welcome Cure as a brand took birth more than a decade ago, while these two software solutions were always there. But for those who don't know, Welcome Cure came into existence as a telemedicine platform. So via voice, video, and text, our whole idea and goal was that regardless of one's geographic location, how could one access the best doctor?
Good afternoon, doctors. Hi, this is Derek here. I'm so sorry we had to stop the video in between. I think we are having some technical difficulties. So, can you give us 2 minutes to fix it and we will resume with the video? In the meantime, if you all have any questions, you all can please feel free to ask me. Hi, this is Derek Fernandez. Today we're going to be talking to Puneet Desai, the CEO and co-founder of Welcome Cure. They have come up with this amazing technology by the name of Nidan AI. Yes, AI, even I'm surprised and I'm curious, how is this AI technology going to be helping us in our day-to-day lives? How is it going to change the medical fraternity? How is it going to be impacting everything? Let's take all the knowledge, ask him all the questions about the product, and let's try to understand how helpful this product is going to be to us. So, hi Puneet, it's really great to have you over here. Today, we are going to ask you a lot of questions regarding the AI that you have developed and what is Nidan AI. So, let's hear it from you. What knowledge can you give our viewers and how it's going to revolutionize the entire fraternity? All right, so let's begin with the questions if you are comfortable.
Sure, lovely. So great, Derek. Nice to be here today on this podcast, and I am equally excited to share as much knowledge as I can about this cutting edge technology that we are launching from the House of Welcome Cure, which is Nidan AI. And as the word rightly says, that it's a AI tool, it's a AI solution. Before I actually kind of dig in very deep as to what this solution does, answering your first question, that what is it, if I have to see it on a helicopter view idea and a very layman's language. So friends, first and foremost, most of you would know it, but for those who don't, just quickly I would like to begin with the fact that overall Welcome Cure as an organization, as a brand, this has been the brainchild of Dr. Jawar Shah, and he has been a pioneer in kind of developing technology tools and solutions for the medical fraternity. A lot he's done for the Ayush stream and for the homeopaths in particular. And this is the same entity, this is the same technology solution provider group which has given great products like the Homepath software. Today we have the Homepath Zomeo software present in about 145 plus countries, and 100,000 plus doctors use it, and it helps them find right remedies in their practice and really is a great support system. Then there is also the Firefly mobile application. So we've always been involved in kind of developing cutting edge technologies which have been, I would like to say and take the liberty, a bit ahead of time, and most importantly something which has always empowered doctors, the care providers, the medical fraternity. Welcome Cure as a brand took birth more than a decade ago, while these two software solutions were always there. But for those who don't know, Welcome Cure came into existence as a telemedicine platform. So via voice, video, and text, our whole idea and goal was that regardless of one's geographic location, how could one access the best doctors, best quality medicines, and have an end-to-end, solution for their healthcare needs, a complete treatment protocol, a complete treatment setup in place to see great positive patient outcomes. So we've been blessed now. We feel very fortunate that in these last 9-10 years, we've landed up seeing more than 2.5 million people in over 36 countries where they've interacted with doctors, they've availed some subscription programs, they've been empowered with not just doctor consultations but even quality medicines, and then frequent follow-ups and good quality outcomes that have come in their healthcare. We've touched a lot of lives. While we had these separate programs for doctors using softwares, for patients using the telemedicine platform, this is one of our first programs. Nidan AI program is the first program which is something that simultaneously in tandem kind of impacts and benefits both the doctor and the patient. So we essentially came up with this tool for doctors to have better diagnosis of the patients, and for patients to have a very quick body parameters and vital indicators coming to them in a way by which artificial intelligence is leveraged in a completely non-invasive and a very cutting edge technology leveraging medium.
Oh wow, Puneet, you have given us a great background of what Welcome Cure is, and a long decade of a company who has developed so much of technology for us, helping us.
Not a
Which
decade, more than about two and a half decades.
oh wow,
Yeah, because the telemedicine solution was about a decade old.
Okay.
But the software solutions, we've been empowering doctors in across the world for almost now more than 25 years. So it's been about two and a half decades. But yeah, sorry.
That's amazing.
Yeah.
So this shows how reliable you are, how sustainable you are, and how much more you can go with this. Now, but
Absolutely.
you have still not answered anything about Nidan AI to me, and you have kept me in that suspense, and you have still kept curtains on Nidan. So before we get into that, I'm damn sure our viewers also will be very confused and curious, more than confused, to understand what Nidan is. What is the meaning of the name Nidan? Let's begin with that.
Okay, sure. So yeah, sorry, I gave a lot of background of the company, and I gave it in a one-liner that Nidan AI kind of helps to diagnose certain key vital body parameters leveraging AI. That's all I gave you, and I understand the curiosity of can we know more about it. But what I mentioned in what Nidan AI is, the answer to the question as to why the name Nidan lies in that particular fact itself, that Nidan as a word means diagnosis in Sanskrit. So we wanted to really kind of bring up a name which
Okay.
is with our roots. So Sanskrit is a language which has been rooted in India. We've been a made in India company, only made in India company who's made a lot of cutting edge technology tools for homeopathy doctors, for the medical field. There are some tools which are not from India, even after like 25-30 years. They are based out of Europe, US, who empower the medical fraternity. So we deeply, strongly feel the whole cultural connect, the India connect, and Nidan in a simple explanation as a word means diagnosis in Sanskrit.
Now the complete thing makes sense
Yeah,
to me. Huh?
yeah,
So
yeah.
you mean to say diagnosis using AI?
Correct.
Okay, amazing. Now this is getting us more and more curious.
Yeah.
So again, what does this tool do? Like, how is it helpful?
So, see, very frankly, as a technology company, we always have been keeping our eyes open in terms of where the technological world is moving, what are the advancements, what are the futuristic tools. I'm sure you, all the viewers today, and generally people at large, have been not for a short time now, but for a fair amount of time, been listening to the word AI. It's become more of a
Absolutely.
lingo and a very cool word. But essentially, do we land up using AI in our daily practice? Very recently, yeah, maybe for some people to the level of maybe using a tool like, say, a Chat GPT. And
Correct.
now, getting DeepSeek and Grok and Gemini. So there's a lot of these. But beyond that, similar functionality to Chat GPT, you talk about major population, major part of the population. If I talk about the medical field, whether it's doctors, whether it's patients, whether it's various other stakeholders, AI is still just a lingo. What we are using today AI for is purely to kind of get some knowledge, information on certain queries by leveraging these Chat GPT kind of tools. Coming back to the fact that as a technology company, we always thought that AI could make a very, very strong impact on healthcare. It could really make lives better, easier, giving care, getting care a lot more convenient. And thus, that whole thought was that what is the most basic thing that we could start with. Of course, we hear a lot about using artificial intelligence for robotic surgeries. There is some early work that is happening there, but if I had to really see that something that could be used by any doctor, by anybody who has a small, big, or acute or a chronic health condition, how could they use AI in the most simplified way which could really impact them? So Nidan AI essentially is a tool where by a simple 60 seconds face scan, 1 minute का facial scanner with any smartphone or a tablet.
Oh.
Okay, so you don't need any high tech, high end apparatus, no equipment, nothing, just your basic smartphone, and we get a link on that. Either a doctor could do it in their clinic, or a patient could be sent a link by their doctor or directly from Welcome Cure Nidan AI, and on their smartphone they could simply be still for 60 seconds. It would prompt them how near do they need to face the put the camera, put the handheld device on, and with just a still face for 1 minute, the technology would give you 25 key body vitals and parameters, which would be things like your blood pressure, your body mass index, the BMI, nearly 10 cardiac parameters, so for your heart health.
Wow.
And something revolutionary and game changing and cutting edge is also your HbA1c, which is your 3 months average blood sugar. आपका 3 महीने का ब्लड शुगर ग्लूकोज लेवल्स जो है वो 3 मंथ एवरेज जो HbA1c टेस्ट बोलते हैं, that is coming in a non-invasive, without a needle prick. It is coming with just this 60-second facial scan. So Nidan AI, if I have to put it very simply, is this technology जो आपके कैमरा, फ़ोन के कैमरा के, स्मार्टफोन के कैमरा से आपके फेस का एक स्कैन करता है फॉर अ मिनट, फॉर 60 seconds, and then within seconds, once that 1 minute scan gets over, within the next couple of seconds, it generates a report just the way a traditional diagnostic or a lab, pathology lab would do it. Nidan AI is not a replacement to the traditional diagnosis and pathology centers, but what we are saying is that this is a great preliminary tool. आप को आलस आता है जाने में, डॉक्टर्स आपको प्रिस्क्राइब करते हैं, रिपोर्ट आने में समय लगता है, 1 दिन 2 दिन लैब आपको रिपोर्ट देने में समय लेती है. दिस इज एन एक्सट्रीमली क्विक टूल with very good accuracy levels. Okay, with all the clinical trials and everything that is done, from a 91 to 99% accuracy level depending on various of these 25 parameters. This is a great tool, and what we say is that assume something is coming out of parameters, it's a red line marker, something is not in the range, then we suggest you go to a traditional lab, pathology center, and just re-verify it.
Okay.
And we have seen fantastic results. You know, it's not conducted on few hundreds or few thousands, but tens of thousands, lakhs of people, and the tool has been extremely handy, useful, near to accurate for most of the parameters, and which is why from some of the most credible authorities, government bodies, medical device certifying agencies, this has certifications from various parts of the world. So that's what Nidan AI is. It gives you 25 body parameters with a 60-second facial scan.
Amazing. Now you have almost answered most of my questions in this one good decent para, but I would still ask you, like, now you also mentioned, Puneet, that it is not going to replace the standard diagnosis, right? So how would it be helpful to the doctors and how would it be helpful to the patients is what I'm trying to understand over here, or what would our viewers like to know?
Yeah, sure. So yeah, great question, Derek. This tool has been designed keeping in mind both, as I said, the care provider, the doctors,
okay,
and the patients. Both of them can independently use it.
Okay.
If I have to kind of split my answer into two, so specifically to doctors, generally होता क्या है कि as a doctor you get patients, you kind of have, with your wisdom, intelligence, experience, you ask certain questions and you realize what could probably be wrong. Just to verify your doubt and your speculation, you kind of want to see whether certain parameters are out of range. So what a doctor typically does is, of course, writes you some medicines and then would tell you that why don't you get these tests for me and then come back to me, or maybe write the prescription, the medicines after those test comes.
Correct.
Now this process usually is, मैंने आज आपको prescription दिया, and then the same day or the next day you would go, depending on the intensity, severity of your suffering, of your disease, of your ailment, and then you would get that report, which will again take a good, I would say 24 hours to sometimes even 48 hours for the lab to give you that. So for doctors, what we wanted to do, point number one, was that give them something very instant.
Okay.
So as I mentioned, Nidan AI does a scan in just 60 seconds. So assume a doctor keeps their phone or a spare phone or their assistant's phone, or if they have a compounder making the medicines, their phone with a simple 150 rupee, 200 rupee tripod, and that very smartphone. It doesn't need to be a separate phone, just a smartphone. And if they keep it in their clinic anywhere at a suitable location, and the patient does a 60-second scan, and right there and there the doctor gets to see 25 vitals, which I mentioned on the cardiac health. India is the global capital of diabetes, of sugar disease. So, and a lot of cases right from now young age to, of course, the slightly older ages and senior citizens, cardiac issues are also on a massive rise.
Absolutely.
So, and blood pressure is, with the stressful lives, hypertension and all, is an issue. So what in the first phase we have done is that, your hypertension issues through your BP, your cardiac parameters, which are almost 10 parameters, and your blood sugar levels on a long-term 3-month average basis, we've incorporated these through rigorous trainings and clinical trials, and done on a lot of people, and we have now ensured that the doctor immediately gets it. So the doctor can prescribe a bit faster. That is point number one. And second, they are also able to build a lot of trust, faith with their patients, because as I said, सब बातें करते हैं AI की, but imagine there is a small A4 poster in a single place or a couple of places in your clinic that this is an AI powered clinic. Automatically there is a lot of curiosity in the patient. B, once they experience it, there is a lot of respect that, look, my doctor is moving substantially ahead with time and using tools and technologies which can help him and me for better healthcare, for better care and monitoring of the health. So it kind of, again, coming back, quickly helps doctors to get certain key body vitals parameters to prescribe better in a speed fastly manner. Second, elevate their overall perception with the patient, with their overall consumer base. And third, and very important, we are giving this tool to them in a subscription based model, so they could avail from us about a pack of 50 scans, 100 scans, and they could refill it, and it comes to them at a certain affordable price point. So we do not actually control that how much would they actually charge their patients. So a doctor could just make it a part of their fees, or what we feel and the way we've kind of priced it, I think reasonably they could make a 2x or a 3x or even a higher number of the small investment that they do to get this subscription pack by taking a certain extra fees from their patients, because they are actually delivering them a report which would otherwise cost them substantially higher. Like, just to give you an example, an HbA1c test standalone across India average is a good 350-400 rupees minimum to ideally 450-500 rupees in most places.
Okay.
And I'm pretty sure that when I reveal the price of the subscription and things like that, the patient will end up paying lesser than this price and not just get an HbA1c test, but 10 cardiac parameters and a lot of other, their stress levels, a lot of key body physical vitals and everything. So it will be a win-win for all. So to just quickly summarize, Derek, it's a great tool for them to quickly prescribe in a very quick manner, getting certain vitals which can help them prescribe better, know their patient's health better, elevate their overall perception and mindset of patients towards them, of using some really great cutting edge technology in their practice. And third, and very important, kind of also maximize their income, revenues and profits by charging us a fairly higher fee to what the each scan cost them, but still save a lot of money for their patients also. So these are predominantly the benefits for the doctors. Coming to the second part of it, as to what is the benefit for this particular tool to the patient.
Correct.
Let me ask you, Derek, आपको 10 बार कोई डॉक्टर ने रिपोर्ट लिखा है, did you actually go all 10 times and got it done?
Not really. I don't think
thanks
everyone.
for your honesty. So as I said, जब तक बहुत severe नहीं होता है, sometimes when you are not in a very bad health situation where your complete focus of yourself or the family is on ensuring good results, coming out of that ailment, coming out of that health condition fast, you sometimes tend to be a little relaxed.
Correct.
Because this involves going to a lab, finding a lab among so many which are there, then kind of, waiting there, there's a wait time, then waiting for the reports to come, go back to the doctor. There are some doctors who are now say send it to me, I'll see it, but many a doctor still prefer that आप report लेके मेरे पास आइए. So if it's not too severe, patient unfortunately starts ignoring their own health, wellness, well-being, and they get lazy. So ये एक human character है, it's a human nature thing. So one, they feel that. B, today many patients also feel that it is an added cost to, okay, I had some issue, I went and met the doctor, I have the acceptance that I have to pay my consultation fee to the doctor, but now I have no clue, I have a huge list of tests prescribed, how much is it going to cost me, and things like that. Sometimes again human psychology, to even save that, you say, yaar, theek hai yaar, let me just take the medicines which doctor is saying, let me see for a few days how do I feel with those medicines. Unless doctor doesn't really insist again कि report का क्या हुआ, I'll be silent and I'll see and I'll save some money. So on the patient side, if you see, let me leave the cool aspect of the tool and the cool quotient around ke wow, but it's saving them so much time and money, and through a tool which, as I said, is certified by US FDA, the CDSCO of the Indian government, and sits with an accuracy rate of 91 to 99% on various set of parameters from this pool of 25 parameters, and it is so quick for them, and most importantly extremely cost effective. So that's on the patient side of it. And like I said, they may not even now need to do a separate, not even go home and do it. Doctors, if they visit the doctors, they could do it there and there in the clinic. If they are using telemedicine, they're not really visiting the doctor could send that cutting edge technology in their practice. And third, and very important, kind of also maximize their income, revenues and profits by charging us a fairly higher fee to what the each scan cost them, but still save a lot of money for their patients also. So these are predominantly the benefits for the doctors. Coming to the second part of it, as to what is the benefit for this particular tool to the patient.
Correct.
Let me ask you, Derek, आपको 10 बार कोई डॉक्टर ने रिपोर्ट लिखा है, did you actually go all 10 times and got it done?
Not really. I don't think
thanks
everyone.
for your honesty. So as I said, जब तक बहुत severe नहीं होता है, sometimes when you are not in a very bad health situation where your complete focus of yourself or the family is on ensuring good results, coming out of that ailment, coming out of that health condition fast, you sometimes tend to be a little relaxed.
Correct.
Because this involves going to a lab, establishing, finding a lab among so many which are there, then kind of, waiting there, there's a
Right.
wait time, then waiting for the reports to come, go back to the doctor. There are some doctors who are now say send it to me, I'll see it, but many a doctor still prefer that आप report लेके मेरे पास
आए.
आइए. So if it's not too severe, patient unfortunately starts ignoring their own health, wellness, well-being, and they get lazy. So ये एक human character है, it's a human nature thing. So one, they feel that. B, today many patients also feel that it is an added cost to, okay, I had some issue, I went and met the doctor, I have the acceptance that I have to pay my consultation fee to the doctor, but now I have no clue, I have a huge list of tests prescribed, how much is it going to cost me,
Correct.
and things like that. Sometimes again human psychology, to even save that, you say yaar theek hai yaar, let me just take the medicines which doctor is saying, let me see for a few days how do I feel with those medicines. Unless doctor doesn't really insist again ke report ka kya hua, I'll be silent and
Correct.
I'll see and
Makes
I'll
sense.
save some money. So on the patient side, if you see, let me leave the cool aspect of the tool and the cool quotient around ke wow, but it's saving them so much time and money, and through a tool which, as I said, is certified by US FDA, the CDSCO of the Indian government, and sits with an accuracy rate of 91 to 99% on various set of parameters from this pool of 25 parameters, and it is so quick for them, and most importantly extremely cost effective. So that's on the patient side of it. And like I said, they may not even now need to do a separate, not even go home and do it. Doctors, if they visit the doctors, they could do it there and there in the clinic. If they are using telemedicine, they're not really visiting the doctor could send that link to them and they would get this. And both the doctors and the patients, Derek, they get a very simple to use dashboard by which it permanently on cloud servers, the parameters remain there. So in a very safe, secure, encrypted manner, both the doctors and the patient are able to store this report. So they can either just see on the cloud the parameters, or through the dashboard that we give, or they can actually download it on their local device, both the doctor or the patient, and store a report like your traditional report which you could have from some of the large labs. There are so many in our country.
Okay.
Just the way you get a paper report or a PDF report, you actually get a printable report on your email, WhatsApp, and all of that. So it's also having your health check, your key body vitals with you handy always. The win-win for both of them.
All right. Okay, that sounds. You have again now. I have a couple of questions in this that you have told me. Now, to begin with, first, like you said, doctors can use this widely. I would like to understand what kind of doctors can use this.
Oh, there is absolutely no such limitation or
Any
ऐसा
particular
नहीं है कि
kind of-
ये एक डर्मेट के लिए अच्छा है या ये खाली कार्डियोलॉजिस्ट के लिए अच्छा है क्योंकि इसमें 10 कार्डियक पैरामीटर्स है.
Correct.
This is used. I mean, India today has, so you don't have to be kind of conversing with people. Just do justice for a 60-second as possible as still face, and the camera of the technology is such that the frame of the camera of the phone kind of prompts you as to the distance.
Okay.
If it's on a tripod, great, no issue. But mostly I've seen people in all our trials which it's held by the phone. You just have to kind of make sure that you are still for a while. 1 minute anybody can keep it still. So it will prompt you that your scan is going on smoothly, and it will also show you the progress.
Okay.
So whether it's at 9%, 18%, 27%, 50%, 75%, 98%, and by the time it shows you 100% done, analyzing your report, which takes a few seconds, you can be at ease, you can start talking, you can do what you are doing until those few seconds that the report has been generated on your screen for the doctor or for yourself.
So you're saying the report will be generated immediately?
Absolutely.
No waiting time?
Absolutely
No
right.
2 days, 3 days to get the report from the lab?
Absolutely right. That's the whole thing. That's what I said earlier.
Are you serious?
Very very serious, dead serious. 60 सेकंड खत्म होता है, 1 मिनट खत्म होता है, उसके बाद ज़्यादा से ज़्यादा अराउंड 4 to 5 seconds more, 4-5 सेकंड लेता है, and it quickly generates your result.
थोड़ा तो रिस्क रहेगा यार इसमें. I'm like, camera is going to take so many things. What are the health risks? कुछ तो side effects, something.
No, so see, like, okay, to answer this, आप फोन के स्क्रीन में आपका 1, 2, 3, 4 घंटा आजकल की पीढ़ी तो डाल ही रही है. You are reading news, you are watching movies, you are playing games. What are you doing? You are just looking at the screen.
Correct.
There are no ultraviolet rays if there is a medical device which is giving some kind of rays or something. ऐसा कुछ नहीं, और आपका स्मार्टफोन है.
Okay.
So you are taking selfies all during the day. What are you doing? Looking into the camera, or if you are with a group of people, वही तो हो रहा है.
तो
So
आप
there
कह
is no
रहे
health hazard.
तो आप कह रहे हो सिर्फ एक फोन चाहिए,
एक स्मार्टफोन,
no other tools.
no health risk, no health hazard, and as I said, most importantly, this tool, this solution, and the outcomes that it is giving is with a very high 90% plus accuracy rate, 91 to 99%. Or US FDA in the United States of America, their FDA has 2 licenses for this of class 1 medical device, and the Indian government, any medical device, is a body called CDSCO, so that has also given it a class 2 medical device certification. So it's not just while Indian medical standards are so high, but internationally also the standards are pretty much at par or slightly higher. So even the US FDA has certified it, and soon we'll also have it from the European Union. So it's safe. Completely safe.
I am amazed, and I'm very sure our viewers also will be amazed with whatever you're saying.
Yeah.
Okay. Is some trials been done on human trials?
Yeah. So like I said, these bodies, the US FDA, the Indian government, so they don't just you go with a idea, you kind of do a demo, they feel this is nice and certificate aa gaya. There is a lengthy process which goes almost near to a year, or to ideally it goes to about 18 months. And what happens here is, in a traditional medical setup or hospital setup, blood pressure है तो आप ideally जैसे measure करते हो,
Correct.
वैसे measure होता है, ये tool के through measure होता है. Cardiac parameters है, you'll use those high-end, high-tech gadgets and those equipment and the machinery. You'll measure certain vitals. इसमें measure होता है. आप आपका एक blood prick देके blood sample लेते हो, और आपका फिर वो सेम डे नेक्स्ट डे HbA1c लेवल्स आता है. सो दे डू दिस ऑन thousands of people. Okay, the government monitors this. There are authorities, departments who then do a comparison. So when I say 91 to 99%, it has been a comparison between traditional pathology diagnostic and this tool,
Okay.
and this AI tool, and they see the variance, and when they realize that wow, it's quite accurate, it's quite effective, and it's near to the same parameters as what came in a traditional setup, is when, and not on few hundreds, but when it is done on thousands of people, and once it is verified, certified by layers of checks and people, competent authorities and people, is when these certificates come in.
Okay, so the accuracy level is so high.
Yeah, that's correct.
So you're saying it's almost above 90%.
Yeah, so some parameters it's 99%, some parameters is 95%. So, but the range of accuracy, as I said, is anywhere from 91 to 99%.
Isn't that amazing, guys? I'm like, technology has gone so far, and thanks to Welcome Cure, that we can take it ahead and ahead. Okay, and how long is it? How long are the reports stored on the cloud?
So see, on the cloud in an encrypted environment, it will always be there. The PDF report, one can choose the doctor or the patient if they want to save it on their device. So there is no PDF stored by the company. Only the body vitals are there, and it's on cloud. It's on. We use Amazon Web Services, AWS. So it's on cloud servers, and the reports are on a physical device. So the PDF report is not on cloud except the vitals.
Correct.
What is actually there, the report, is on the patient or the doctor's laptop or desktop or a mobile phone or a tablet.
So if as a doctor I want to check the report probably of my patients after a month,
Correct.
can I do that?
Absolutely, that's the beauty. So doctors always have a patient record, and
Yeah.
then they write when did they come.
Correct.
And they have to note down. But here, if assume you go to a family doctor, your general physician, or for a specialized doctor also, you are continuously going to them. So the good part is every time you go, they can refer to your previous vitals, and if there is any improvement or deterioration in those vitals, because as I said, it's all on encrypted cloud based servers, and they would need to see this. Patient also wants to track कि मेरा पिछला report ऐसा था, अब कैसा है. Doctors also want to see how my patient is progressing, which is why it is at least the vitals are stored on the cloud. And then depending on the space that everyone's phone has, it's always good to save it on the local by at least the patient.
Okay. And how often can we do this as a patient?
So very frankly, there is again no such limit. Okay, you could do it 3 times a day, you could do it once a week. It doesn't stop you. I've had a lot of people जो just to check the accuracy of the tool, they do it on the next day to see कि मेरा change हो गया क्या, and they are shocked कि अरे it is the same or more or less the same. But in reality, I think for any sound, healthy person, because see, this is not your random blood sugar.
Correct.
Or your fasting blood sugar, or a post lunch blood sugar, where you need to do it every day or this is a 3-month average. Your blood pressure, your cardiac health can fluctuate with each day and week, and it's very dynamic. So for a sound person with no or less health issues, I feel we recommend that doing it once a month is great.
Okay.
And because of the fact it's so simple, it's so quick, and you don't need to go somewhere, you can do it from your smartphone. I think once a month is a great frequency to do it. But yes, it could be need based. If you're visiting your doctor once a quarter, doctor does it every time, then it's fine. But there's no thumb rule. But since it's cost effective, since it is kind of non-invasive, and if you really want to care for your health, I feel ideally it's great to do it once in a month basis.
Okay. Now, Puneet, you have mentioned it couple of times. Cost effective, fast. What is the cost of it? Like, what is the cost? Like, what is the hidden cost?
So there's no hidden cost, and we strongly feel that we've built a very affordable solution. When I talk about affordability, it's from the viewpoint of generalization also, and B, in terms of comparing it with traditional pathology and diagnostic costs. So currently what we realized is that we want to give doctors an option of flexible programs.
Okay.
So while we may launch some more subscription plans in the future, right now what we are doing is that we are launching 2 programs. So there'll be one program which will empower the doctor, equip the doctor with a subscription program of 50 scans.
Okay.
Okay, so as a doctor, you have a bank of 50 scans which you could conduct either on 50 different patients, or if you want to give some patient a pack of 2, 3, 5, 10, that's up to the doctor. But a single scan, about a pack of 50 scans, and the second one which is going to be of 100 scans, which is what when we did some kind of a research and when we spoke to a lot of doctors, because they've been using some of the other technology tools from us, so they all were very happy and excited about the 100 scan pack. So we've not gone for something lesser than 50 at this moment, nor have we gone for something much higher, which some doctors told us, but we've kind of kept it very simple. So these 2 programs today, we've priced it in a way where the 50 scans is priced at 10,000 rupees plus GST. Okay, so about 11,800 rupees, and the 100 scan pack, which will cost them 18,000 rupees plus GST. It just go somewhere about north of 20,000. So what is happening is that the doctor would typically land up having a landing cost at home of just about 200 rupees per scan, which means now they can give it to their patients at 300, 350, 400, 500. I mean, they can go as high as they want, but I think anything up to 500 is a reasonable, fair price for the patient to pay. And or there are some doctors who already charge a good amount of fee from their patients. Their prices are pretty good, so maybe they could choose to just give it as a part of their fees itself and not charge separately. So assume some doctors charging 1,000 rupees as a consultation fee. They may tell the patient कि यार आप मुझे 1,300 दे दो, 1,250 दे दो, 1,400 दे दो, 1,500 दे दो. I have also given you a pathology report.
Correct.
So somebody may question, sir, आप तो 1,000 रुपए लेते थे. Yeah, I've given you that. And see, the patient is also getting something tangible.
Correct.
They experience an AI technology. They got a report in their phone and as a PDF in their WhatsApp or email. So they find value because there's something tangible. उनको कुछ मिल रहा है जो उनको पता है कि इस चीज़ पे मैं 500, 800, 1,000, 900, 1,500, 2,000 खर्चा करता हूँ in a traditional pathology lab center. So we've tried to do this cost, but here's the important part. Now, while this is its price that we have decided, I am extremely happy to share with you, our viewers, that as an early bird option, that for a select few thousand doctors, I am going to make this even more attractive. What we are going to do is that the 50 scan pack, which costs about 10,000 plus GST, I'm going to give it at 6,300 rupees plus GST. Okay. So yes, you all have heard it right. This is going to come to you all at a very strong 37% discount on the 50 scan pack, which means instead of 10,000 rupees, you will get it at 6,300 plus GST. So this will be under 7,500 rupee. So per scan cost will be as low as about some 125 rupees type of a thing. And the popular pack, which is the 100 scans pack, जो 18,000 plus GST था, we're going to slash it down to 50% as an early bird offer. So it will come at 9,000 plus GST, so about 10,000 rupees, which means a single scan could cost the doctor just about 100 rupees. Approximately it comes to around 104 rupees. Now whether you are giving it free to your patient, whether the doctor is charging 200, which is double, which is 250, 300, like nobody is going to ever say no for a great report, diagnosis tool, service like this, 300-400 rupees. So our goal and aim, coming back to your earlier question, डॉक्टर को जल्दी से कुछ अच्छे वाइटल्स, की वाइटल्स पेशेंट के टू बेटर प्रिस्क्राइब मिल जाए, उनकी परसेप्शन बढ़ जाए. जो मैंने थर्ड पार्ट बताया था कि देयर प्रॉफिट, देयर इनकम increases multifold. This is a great tool, and that's why for the few early 1,000 doctors, we want to, and as them to realize that this technology is so easy and simple, why it may sound AI, so we've kind of making it at nearly for the 100 scan pack actual 50% off.
Amazing.
So just about 100 rupee cost per scan to them. They are free to charge what they want to.
Now this sounds so exciting that even I am willing to pay. So what are the modes of payments that you all handle? Like what are the mode of payments that doctors can pay using?
Anybody can come on nidanai.welcomecure.com. So it's NIDAN AI, A for Apple, I for India. So nidanai.welcomecure, which is one word, welcomecure.com. They can come there and very simply, just like buying something from a Blinkit or a Zepto or a Flipkart or an Amazon, you can select one of the two subscription plans. Individuals have a separate section, doctors have a separate section. So if an individual had to buy it, we priced it at 500 rupees, and because we recommend once a month, so the 12 months pack we give a 10% off, and it goes at 4,500 rupees.
Okay.
So for the doctors, we've substantially subsidized it. So the 50 scan pack is 10,000 plus GST, and the 100 scan pack is 18,000 plus GST. But as the early bird offer, it's just going to be 6,000 plus GST, under 7,500 rupee, and 9,000 plus GST, just about 10,000 rupees. So they can just go on the website and buy it. It is going to be very simple. On the website, they'll have an option to pay via UPI, credit card, debit card, and all the possible tools and options available for payment methods. Otherwise, of course, we have a lot of support team members, sales team members. They're always there to kind of help them with sharing bank account details, so they can just make a bank transfer, or simply getting a QR code in their phone and pay through that. So every possible convenient and preferred medium of payment is available for the doctors to avail this subscription.
And how fast can I start? Like as a doctor, if I made a payment to you, how soon can I get started? Like,
oh, so like
couple of days?
No. So since it's a technology product, so it's not like, you know, you ordered a garment
Correct.
or t-shirt from Amazon and they'll at least need a day or sometimes 2-3 days or a week for it to be delivered. It's not a technology product. So you'll be happy to know that the minute you purchase this, you will in real time on a successful transaction see that आपको एक email आ जाएगा. In your email you will see a dedicated username which will always remain, and you'll get a password which you have the option to change. And with those credentials of the username password that we gave, as soon as you log in, you will immediately see 50 scan or 100 scan credit. You can just add patients and start either seeing them in your clinic, or you can start forwarding them a link to use that scan, and you will be able to see and track everything on the dashboard. Extremely easy, non-complicated. Adding patients, seeing how many scans are utilized, everything is all there in your simple to use web app. So it's like you're getting a mobile application from us to track, monitor the number of scans you have, what amount you paid for it, which patients have done it, what are their vitals, everything, क्या parameters हैं उनके, सब कुछ उसी एक single web app में दिखेगा आपको.
Okay. So now you kept saying that it is easy to use. Okay. So what does the doctor get? Like, and how can he add the patients, and what are the kind of information he needs from the patients?
Yeah. So see, beyond one's name, contact number, and email, and the gender. So these are the 4 basic, I would say, a patient or a customer KYC.
Okay.
So name, so you can identify आपने किसका किया, you know, the gender, and most importantly the number, so that if you need to send a WhatsApp, SMS link, and the email, so if you need to email the vitals and the report to them, so these are the 4 basic KYC details we need. When it comes to the outcomes that this AI tool gives, the thing which one needs to be very honest about, and the only simple parameters that we need from the patient, the doctor needs to have a judicious, honest, sacha answer from the patient, is the date of birth.
Okay.
Okay, so while you register a patient with the name, contact number, email, and the gender, after that it asks you about the date of birth. So automatically the tool gets the age. B, it asks you about the height.
Okay.
So the height could be either in feet and inches or in centimeters, whatever is comfortable and whatever the patient remembers, in both formats. And third is the weight.
Okay.
So these are the only 3 parameters that one needs to be giving to the doctor judiciously, honestly, as a very sincere, honest input to the AI tool. ये 3 चीज बड़ी जरूरी है. अगर आपने कुछ 19-20 उल्टा फुल्टा गलत बता दिया है ना, कि मुझे मेरा वेट 102 है, मैं 90 बताऊंगा, 85 बताऊंगा, you are suddenly saying born in 1986 instead of 96 गलती से, तो वो पैरामीटर्स रॉन्ग आएंगे. तो ये तीन चीज़ थोड़ा वेरी सिंपल पैरामीटर्स, किसी को कोई छुपाने की ज़रूरत नहीं है. आपका हाइट, वेट और एज, ये तीन ही पैरामीटर्स आपको चाहिए. सो इधर डॉक्टर कैन एंटर इट वाइल रजिस्टरिंग द पेशेंट, और द डॉक्टर कैन टेल द पेशेंट भैया ये सब आपकी डिटेल भर के दे दो. एंड बिफोर दे स्टार्ट द स्कैन, just say that, spend that 15-20 seconds to quickly verify the data. As simple as that.
Seriously.
Yeah, that's all it needs.
So then
the rest of the work AI does.
Well, so what? Okay, now how secured would my data be? Like, if I'm entering all my patients, like roughly as a doctor, if I have say about 100 patients
Sure.
or 1,000 patients, I'm putting all my patients in that data. How
Sure.
how secure my data?
Like
would
I
be?
said, this is only going to be accessed via your own dedicated username password by you, and it's all on cloud servers, secure and encrypted. So there is absolutely no data risk. The data remains only with you and the patient for that particular patient, and for your pool of patients, it's just with you on cloud servers in your dedicated system dashboard, the way you have it. Just like you're using maybe Instagram, you're using Facebook, you're using Twitter, or now it's called X, you're using Telegram. So it's only you who sees who's on your friend list, what have you liked, what
Your
have
DMs
who's posted what, your personal messages, when you use WhatsApp as the most simple. So it is all on cloud, and only you see what you see. It's all encrypted in a very simple way.
Okay. Okay, great. Now that sounds pretty interesting. Okay, so now also what I would like to understand, or like what our viewers would have in mind, what about the support staffing? Like, what if I get stuck somewhere, or it's like you said, it's a technology product.
Yeah.
अभी technology है, कुछ तो glitch आ सकता है. When I'm scanning the face, something went wrong, customer को report नहीं मिला, कुछ चला नहीं. It's technology. Like even if we take
Sure.
our phones,
Sure.
we have that problem. Like
Sure.
WhatsApp crash हुआ है, Facebook crash हुआ है, Instagram
Right.
crash हुआ है. So what about the support system that we are, the doctors or patients are getting provided with?
So see, as I mentioned, coming back to your very first question, who's behind this? So we've been a technology company for a couple of decades now. We have a dedicated in-house team of IT professionals who not just develop these cutting-edge technology and tools, but at the same time operate and maintain it. So what happens is, if ever there is any hitch, which could be in a very rare case, so the team is always available on the technology side to kind of fix it. If it is something operational which the doctor couldn't gauge or the patient couldn't understand, then there is also a support team which is only focused on after sales support. So technical support is one aspect, but even after sales support of मेरे को कैसे यूज करना है, या ये इशू आया कि ये प्रॉब्लम है, तो देयर इज ऑलवेज समबडी, दे विल आस्क कि आपका डिवाइस क्या है, आप क्या एनवायरनमेंट में हो, क्या आप एक बार लॉग आउट करके लॉग इन कर सकते हो. दोस काइंड ऑफ बेसिक things also, there will be a support team. Also, many a times, because this is all happening on internet, so assume, I mean, we have seen it say 1 in 1,000 times that scan हो गया और रिपोर्ट नहीं आया. Okay, so good part is वो it will never be deducted from your bank of scans. अगर रिपोर्ट जनरेट नहीं हुआ है तो there is a good 18 to 20 minute window, the way we programmed and designed this, कि वो आप वापस एक 18 मिनट 20 मिनट तक आप वापस कर सकते हो. अगर रिपोर्ट जनरेट नहीं हुआ है तो इट्स अ फेयर अमाउंट ऑफ टाइम कि सडनली इंटरनेट नहीं था, या बीच में स्कैन अटक गया या स्कैन कंप्लीट हो गया, तो वो फिर से शुरू कर सकते हो.
Okay.
So those things are kept in mind. Certain external factors, प्लेटफॉर्म में कोई प्रॉब्लम नहीं होगा, इंटरनेट सर्विस प्रोवाइडर में कुछ फ्लक्चुएशन आ गया, सो द स्कैन विल नॉट गेट रिड्यूस्ड फ्रॉम, अगर आपने समझो 100 स्कैन का पैक है, यू हैव यूज्ड 80 सेकेंड स्कैन में कुछ इशू आया, तो वो 19 अभी भी आपके क्रेडिट में होगा. यू विल स्टिल हैव दोस 19 स्कैन्स बिकॉज द रिपोर्ट इज नॉट generated. So all these things are kept in mind we've kept a tech support team, we've kept an after sales general support team, and the product is also designed in such a way that no scans go waste for either the doctor or the patient, and we are here to always help and support them.
While we are at support, Puneet, also like being a doctor, most of the patients are coming on a Saturday, Sunday, weekend. So does the support staff work over the weekends as well?
Yeah. So we have a support system today, which is like a 9 a.m. to a 9 p.m. setup. Also, what we do is that we have usually seen that 9 on 10 of the support tickets, the support issues, the support requests which come are very generic and basic in nature. So what we are also going to do is we will keep empowering and we will keep the doctors equipped with a very basic FAQ कि ये हुआ तो क्या करना है,
Okay.
ये प्रॉब्लम है तो उसका सोल्यूशन क्या है.
Okay.
तो हमारी ज़रूर भी नहीं पड़ेगी. They can just click on that question and they'll get an answer on the website or a PDF that we send them, and वहीं से आंसर मिल जाएगा. Otherwise people are there to support.
So now, like you said, 80 second पे scan पे problem हुआ तो you have support and stuff. और अगर मेरा scan का pack खत्म हुआ तो फिर क्या? How do I refill it? How do I go ahead with that?
Oh, so again, like I said, it's people are used to in our country to say a mobile recharge.
Correct.
कि आप prepaid card use करते हैं मोबाइल में, आपका खत्म हो गया, you go online or you go to a vendor, आप पैसा देते हो, recharge करते हो, phone starts. It's just as easy and simple as that. So that very platform, nidanai.welcomecare.com, you go in there, or you simply log into your dashboard because you're already a doctor who's using this, and you'll have a renewal option or an add-on option, and you don't need to wait. You don't need to wait for that subscription to get over also. We've also built the technology in such a way that even if you are at 80, 90, 50, 10 scans, you want to buy another pack, तो अगर समझो आपने 100 स्कैन का सब्सक्रिप्शन लिया है, आपने 75 यूज़ किया है, तो आपने एक और 100 ले लिया तो ऑटोमेटिक 125 हो जाएगा.
Okay.
आपको रुकने की ज़रूरत नहीं है कि मैं अभी 100 स्कैन यूज़ करूँगा, देन आई विल रीफिल इट. यू कैन डू दैट. वो उसके बाद भी इट इज जस्ट गोइंग टू टेक अ मिनट for that transaction to happen and quickly have the scan credits. Like let's take for example, a doctor is conducting a camp. ठीक है, you really don't know how many people are going to come. One guarantee I can give you out of experience, and we've done this in India and outside India when we were testing this technology, is that if you use this tool, if you use this program as something which is to attract people on your booth, your camp event, or anywhere where you're trying to attract your services, your solutions, your expertise as a professional, line लग जाएगी. Because this is not something that people use. Now assume डॉक्टर ने कैंप रखा है कोई सोसाइटी में, कोई ऑर्गेनाइजेशन में, इन अ कॉर्पोरेट और इन एनी इवेंट. नाउ यू डोंट नो हाउ मेनी पीपल आर गोना कम. सो imagine because of this tool you had a lot of people and it got over. All is going to take a 1 or 2 minute break for you to refill it. You may think I am expecting 50 people and I have around 60-70 scans available in my pack, but assume suddenly 100 लोग आ गए, 1-2 मिनट का break, you are just doing a normal transaction, scans refill.
So I don't need any human interference or any support to refill it. It is as simple as that.
Absolutely not. आप ही का जो हम आपको जो app दे रहे हैं, that dashboard which you are getting through the web app, you go in that, you go into your account section, you will be simply choosing the last pack which you bought. Either you can buy that or any other pack, and the new pack that you buy, the scan credits gets added in a real time basis.
What if I need more than 100 scans?
So like I said, currently we have these two programs. I did there are two solutions to it. One is that with the time to come, we may come up with a 200 or a 250 scan subscription or a 500 scan subscription plan. But at the same time, like I said, if you made 5 transactions of 100 each, it is not that you need to exhaust one, utilize fully one pack and then. So आपके पास already for peace of mind you will have more. So there is no limit of when can you buy the pack, how many packs के लिए आपको 1000 चाहिए, आप 10 transaction आज कर लो at 9000 plus GST पे, और आपके पास 1000 स्कैन आ जाए।
और ये एक्सपायर कभी होगा? लाइक देयर इज अ ड्यूरेशन, जैसे मोबाइल रिचार्ज के 1 साल के अंदर खत्म होगा, 6 महीने के अंदर खत्म होगा?
So I think we should have covered this question earlier, but glad you came up with this now. So see, again, the beauty is the doctor can use this scan subscription, the pack of scans. They can exhaust it in one day. They can use it in 1 year or whatever time. So there is absolutely no expiry date
Okay.
to the scans. Okay, so let's take a general example that a patient came in. A doctor has not a very thriving practice but a sound practice. So what we feel is कि यार एक 25 working day, leave the Sundays aside and one public holiday, in 25 days at least every day 4 patients is what we feel that they will kind of give this program to. Even if daily there are 4-5 patients coming in, whether it's new or follow up, तो उनका टेस्ट मैं करा लूँ, या एक साउंड प्रैक्टिस में दिन के 10-20 पेशेंट जो आते हैं, तो विद इन दैट पूल आई वांट टू एम्पावर एटलीस्ट 4-5 विद दिस टूल. तो मेरा ऐसा मानना है कि 100 स्कैन का सब्सक्रिप्शन आइडियली 1 महीने में तो खत्म हो जाना चाहिए विद 4 scans into 25 days. And they invested say about 9-10,000 rupees, and they could earn about at least 15-20,000 on top of it अगर आपने आप 200-250 रुपये 300 रुपये में वो स्कैन दे दिया. So that's our overall psychology. Now if the doctor has a very strong patient flow, दिन के 10-20 यूज हो रहे हैं, 50 यूज हो रहे हैं, there is no issue at all. Then I'm assuming there's a dedicated assisting doctor or a compounder or a support staff in that clinic. They could do it. Doctor wants to do it. Patient को लिंक दे दिया, बोला आप दूसरे कमरे में बैठ के स्कैन करा के आ जाओ. It's very easy to use. It'll prompt you how to use it. See, हर स्टेप पे वो prompt देता है कि कैसे यूज करना है. It's very simple. So the whole idea is हमें प्रेशर भी नहीं करना था डॉक्टर को कि आपको उसको 1 हफ्ते में या 1 महीने में यूज करना है. ना हमने लंबा पीरियड 100 स्कैन्स इन 1 year ऐसा भी नहीं रखा है. They can use it in whatever time frame, time band that they want to utilize.
Amazing. All right, thanks Puneet.
Pleasure.
It was really wonderful to this. Actually, I'm exhausted with all my questions and I'm amazed because just before this podcast you did my scan and I was thrilled with the results and the accuracy and the simplicity of this product. And it's unbelievable where this technology you have taken technology now in today's time. So I think our viewers will actually have to experience that. But before we let you go, do you have anything that you want to tell us or anything that you want to share with us?
So Derek, it was wonderful to be a part of this podcast. I mean you were great with asking a lot of important, useful, basic questions. And I hope I've been able to do justice to the viewers by answering it in the most honest, transparent way and share knowledge. And I hope I've been able to add some value to all you viewers and kind of explain what this tool is. In reality, Derek, while it may sound extremely, technology driven, cutting edge, AI stuff, but as you rightly said, before the podcast, I could see the childlike personality that you transformed into by seeing that it was so easy to use. You didn't need much of my guidance. I gave you the phone. You added your name, age, everything, and you added your weight and gender and the height, and you just said, do I press start scan now? Can I do it now? All I asked you was, and for the viewers, that those who wear spectacles, you just need to get rid of them for 60 seconds. So and you did it. It prompted you that what should be the distance, whether to take it closer, and you were like, after a minute, was it this simple? And I also remember you telling me that when it came to your HbA1c levels, you had done your test about a month and a half, 2 months back, and it is sitting pretty much near to what you saw. So it is, while it is, yes, it is cutting edge, yes, it is AI, but it's as simple as what you experienced. And that has been our endeavor, that for my dear fellow doctors, the patients, people at large, making such a useful, handy tool in the most cost effective way, in the most easy to use manner. That has been our endeavor, and I hope that people love the solution. I hope maximum doctors use it. I hope a lot of patients benefit with this, and most importantly, I would definitely urge all the doctors to become a part of our early bird
Absolutely.
benefit, because there the we're trying to democratize the scan cost for them to as little as 100 rupees a scan for themselves. So it's lighter on the pocket to the patients. They could also make a good 2x, 3x, 4x on the scan cost to them, and have those handy vitals and be a part of the revolution, be a part of this AI journey with us. And we would keep working on bringing in more essential body vitals and parameters. I'm getting very restless to say what we are working on, but I'll try to control myself. Beyond these 25 parameters, as an organization, we're already working with certain clinical bodies, authorities, governments to bring in more such parameters. We'll keep you updated, posted with those things. We would be very happy to take whatever feedback comes from all our doctors to even further simplify the use of it. Maybe, like I said, increase the scan count, the scan packages for them, and overall keep striving to give them the best service, the best products, the best after sales service, and truly making it a very win-win situation for them as a doctor and for their patients, and for us to be blessed to serve them with technology tools.
I
So,
would tell all the doctors to just jump in and grab in the offer right away.
pleasure. Thanks for that endorsement, Derek. And we look forward to serving you, doctors. Thank you.
Thank you so much.
Hello, doctors. This is Derek here once again. Thank you so much for being with us and bearing up with everything and going through the video. So yes, we are open for live Q&A now. Please feel free to ask me whatever questions you all have, and I'll be happy to help.
What are the 25 parameters?
Doctor, 25 parameters start with one, you get an HbA1c report. You
Hmm.
get 10 cardiac parameters. You get your body
Hmm.
mass index completely. You have your
Okay.
stress levels. You have your general
Hmm.
well-being. So that includes your blood pressure, oxygen saturation, heart rate,
Hmm.
and all those.
Hmm.
So these are the all 25 parameters that you will get in this.
All right. Okay. Thank you.
Welcome, doctor. Is there any other questions?
Not
Can
from my
use
side.
can use for medical legal purpose?
Yes, doctor. It's a diagnosis tool. So it's a pre-diagnosis tool. So you can definitely use it. Okay. You can get your HbA1c report all and your 10 cardiac parameters, and then probably see whether you want to get any medical treatment done or any further reporting done. Also, there is a question from Dr. Ashok that do we have any connections with Zomeo Homepath? Yes, doctor, it's the same company. Homepath is both under Welcome Cure. So Zomeo is one of the products, and Nidan AI is another product as well.
Uh, Please send that QR code scanner.
Yes, doctor, I will send it to you right away. If you can
Okay.
put your number in the chat, or you can contact my direct number.
Pardon?
You can provide me your number in the chat, doctor, or you can contact me on my direct number, or I'll get in touch with you post the session is over.
Okay. Hmm.
Any other questions, doctor? Please feel free to ask. There was also one Dr. Ejaz Khan who had asked me how to use it. Okay, let me tell you, doctors, it's a very simple to use tool. Okay, you do not need the beauty of this is you do not need to be stuck on one device only. You can use it on multiple devices on your laptop, tablet, mobile, whether it's a old mobile, new mobile, doesn't matter. You can simultaneously you also use it on your devices, so on multiple devices, so you don't need to worry about it. And it's as good as using an Instagram or a Facebook. Okay, it's very simple. All you need to do is just log on with your username and password, and go through, add a patient, add your patient's details, and your job is done, and start scanning the face. It's as simple as that.
Probably, Derek, you could send Dr. Ejaz a demo, small, short 5-10 minute demo
I
video,
did
so
that.
he'll
I
know
did
how
that.
you.
I did that, doctor. I've already done that. I just thought of it like if any other doctors would have the doubt, so I could probably share it. Is there any other questions, doctors?
अभी क्या रेट पड़ेगा?
Doctor, the total rate is right now we are giving you a 50% discount, like how Puneet already mentioned in the video. So 100 scan pack comes to you for 10,620 rupees. And if you're going in for the 50 scan pack, it comes to you for 7,434 rupees.
इसको अगेन इसको अगर अपन सब्सक्राइब कराएं तो कितना पड़ेगा?
तो डॉक्टर अगर आप दोबारा दोबारा अगर इसको सब्सक्राइब करते हो तो आपको सेम रेट पे पड़ेगा. इवन इफ द रेट चेंजेस, you locked on to the same offer till the time you are using it. You will be locked on to the same offer, doctor.
ये ऑफर कब तक है?
ये ऑफर सर 2 दिन तक है, आज और कल.
किसी पे स्कैन करके दिखा रहे हैं क्या आप?
यस डॉक्टर.
दिखाइए.
Derek, I advise if you can send a scan to doctor himself, so he
Sure.
can try it.
Yes, doctor. Do we have any other questions?
ये इसमें यही है प्रॉब्लम कि इसकी रिपोर्ट अगर हम स्कैन करके पीडीएफ निकाल के किसी को देते हैं तो वो कोर्ट के लिए मतलब वैलिड रहेगी कि नहीं रहेगी कोर्ट में? मान लो कोई
Sir,
पेशेंट
this is basically certified. This is certified by Indian CDSCO and
हाँ.
US FDA. So that way it has credibility. However, just to protect you as a doctor, we just write on all our reports that this is for preliminary evaluation, and if required, one can go for further test in a traditional diagnostic and pathology. So we don't want you to be at any risk. While the certifications are there, credibility is there, accuracy is there, but at the same time, even if आज आप एक ही घंटे के अंदर 5 अलग लैब में सेम टेस्ट कराते हैं, डॉक्टर्स ऑलरेडी ऑब्जर्व के काफी वेरिएंस आता है. So we advise that this is non-invasive and quick, and for patient to experience AI, get some quick parameters, and for you to also get a fair idea. So we try to restrict it to the preliminary evaluation part, rather than saying that once this is done, no need to do anything else and you can use this only. So it's better and safe and legal until more evolvement comes in the technology in the time to come.
नहीं, टेक्नोलॉजी तो है लेकिन इंडिया गवर्नमेंट से मतलब वैलिड रहेगा ये? नहीं तो क्या होता है कि ये वर्ल्ड लेवल पे जो होता है एलोपैथ जो होते हैं सीएमएचओ वगैरह ये सब ऑलरेडी आकर के अटैक करते हैं इन चीज़ों को क्योंकि उनकी वैल्यू कम हो रही है पैथोलॉजी लैब की. अब ये लाल पेथ वगैरह दुनिया भर की हैं, ये सब अगेंस्ट जाएंगे हमारे.
नहीं सर, ये CDSCO सर्टिफाइड है जो भारत सरकार का है.
हम्म.
But as I said, in the initial phases, we want to restrict it as a preliminary use, as an initial evaluation, rather than a replacement. मान लो किसी का HbA1c अगर रेंज के बाहर आता है, so there is no harm telling the patient कि आप ट्रेडिशनल लैब में भी एक बार करवा के आइए. बट मोस्ट इम्पॉर्टेंट क्या है, वो 24 घंटा अभी रुकने की जरूरत नहीं है, आपकी क्लिनिक में ही हो जाए. There is an immediate income opportunity in the clinic. There is an immediate parameter for you to prescribe better in the clinic. So we restrict it to a preliminary evaluation rather than a replacement.
हाँ, मतलब लीगल प्रोटेक्शन चाहिए हमको अगर हम यूज करते हैं तो.
नहीं सर, प्रोटेक्शन की बात यही है कि आप पेशेंट को ये नहीं बोल रहे हो कि ये आपको बाहर कराने की जरूरत नहीं है, ये प्रिलिमिनरी के लिए है. रिपोर्ट के ऊपर भी वो स्टैम्प आता है कि USFD और इंडियन गवर्नमेंट का CDSO सर्टिफाइड है. बट वी आर टेलिंग यू लाउडली एंड क्लियरली टू नॉट टेल एनीबडी दैट दिस इज अ रिप्लेसमेंट टू ट्रेडिशनल पैथोलॉजी. This is for a quick, non-invasive, cost-effective solution. If anything comes red, let them be guided to go to a proper traditional pathology center.
तो आप अपने सर्टिफिकेट पे लिख के देंगे क्या रिपोर्ट पे कि दिस इज नॉट पर्पस
Report पे
मेडिको
certified.
लीगल
Yeah,
पर्पस?
yeah, 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 yeah. We Derek, please send doctor a sample report so he'll know exactly what the patient will get.
Sure.
Note down doctor's name and send him a sample report.
Sure.
ओके.
That's for Dr. Umesh.
Yeah. Got it.
यस.
25 पैरामीटर क्या है, एक बार वो लिख के शो कर दिए होते हैं।
सर वो भी आप डॉक्टर
One
डॉक्टर
minute, I'll
लक्ष्मण
do
को
that.
भी एक भेज दीजिए। आप सैंपल रिपोर्ट उनको भी भेज दीजिए, so he'll know exactly all the 25 parameters.
Sure. So, or else I can share my screen and we can show it to them right now as well.
Please, yeah, please, you can.
So, doctors, why don't I share my screen and I will show you what are the parameters that can be used. Okay. Like, can you all see my screen right now?
नो, हाँ अभी देखना शुरू हुआ।
हाँ, तो देखो डॉक्टर, लाइक आई सेड, हार्ट रेट है, रेस्पिरेटरी रेट है, ऑक्सीजन सैचुरेशन, ब्लड प्रेशर, और ये डायग्नोसिस इस कार्डियक पैरामीटर्स में एसडीएनएन है, आरएमएसएसडी है, पीएनएन 50 है, कार्डियक आउटपुट, मीन आर्टरी प्रेशर, हार्ट यूटिलाइजेशन, हार्ट रेट मैक्स, हार्ट रेट रिजर्व, टारगेटेड हार्ट रेट, VO2 max. And BMI may we have body volume, total body water and body water percentage, total body fat percentage, body weight, diabetes control score, HbA1c levels, stress levels and stress index. ये टोटल 25 पैरामीटर।
Derek, I suggest show a report, proper report, if you can.
Yes,
That will be handy for you.
I will show that as well. So इसके अलावा I will show you all the report as well. Just give me a second. I'll just give me a second. I will pull up a report and I will show you a report as well. All right. In the meantime, do you all have any questions? So I can answer the questions while I'm pulling up the reports. Yes, doctor. So if you see, can you all see my screen now?
Yes.
Okay. So if you look at the report, so this is how your report will be looking, which will say if it is a male, then there will be a male illustration. Now, since it's a female's report, it's a female illustration. So this is a very beautiful aesthetic view of this report. While if you see, this will look like a lab report. So if you'll see, your name will be referred over here, the time and date of evaluation, patient's name, gender, height, weight, and your range, the value, key body vitals, everything would be measured and reported over here. Okay. Now, this is how it is also got it from the FDA and CDSCO. And there's also a brief explanation of the vitals over here, parameters over here. And for Dr. Umesh, it's very clearly mentioned over here that this is a preliminary tool. So again, there is no problem for you and you are in a safe zone, doctor.
ठीक. ओके. थैंक यू.
परंतु इस 25 पैरामीटर में सीबीसी, लिपिड ये सब नहीं है ना?
नहीं डॉक्टर.
Not yet, sir. Not yet. उन पे भी काम चल रहा है काफी, clinical trials वगैरह. So hopefully more parameters will be added in the future.
विटामिन नहीं है। ठीक।
In her report पे लिखा आएगा that the report is by your name, the doctor ऊपर as a referring doctor भी आएगा. So the patient also knows. And everybody, Derek, if you'd like to share, that we can also share a nice A4 creative with the doctors,
Yes.
so they can put up a promotional frame or a laminated A4 in their clinic to basically kind of tell the patients that this is available in the clinic for them to use. So basically, it will also there will also be some promotional material for your clinic to kind of tell the patients that a 25 parameter test is available with you.
Yes, doctor. Like Puneet said, we will be sending you all the creatives as well. So, do we have any questions, doctors?
No, Dr. Sanjay, that is the range will be changed in the live environment of the report. It is going to be different. This is a sample report. Apologies for that. So also, Derek, you have 2, 3 doctors whose numbers they have shared and would like a
Yes.
demo. Just
Yes.
contact them, and we'll help them get the experience firsthand for themselves, so that they
Yes.
can take advantage today
Sure,
with
Puneet.
this short time offer.
Sure, Puneet. I'll do that.
Okay, lovely. So thank you all, doctors.
Thank you.
Thank you for spending time this Saturday afternoon. Yes, doctor, you had a question. I heard somebody speaking. Okay. So Derek, if you can just help the doctors with uh, whatever they have asked for in this session in
Yes,
terms
I'll do
of
that.
doubts and queries, and let's help maximum doctors get onboarded on this wonderful program and the offer that we have for today. Thank
Yes,
you.
I'll do that. Thank you. Thank you, doctors. Have a wonderful day.
Please, if you could share the scanner with Dr. Praveen, and earlier also there was a
I'm
doctor.
doing that. I'm doing
Yeah,
that, Puneet.
thank you.
Okay, okay.
And next time, if also Sanket from your team could send a scanner with everyone on the chat, it will be useful for the doctors and handy for them.
Sure. I can do that. Yeah, I can have that arranged, Puneet.
Thank you.
Thank you, doctors. So I will try to share the scanner now itself on the chat for anyone, whoever is interested. Just give me a second, all right, Puneet?
Sure.
Right.
I have sent the scanner. I have sent the scanner on the chat as well, doctor. Hello, Puneet. I have sent the scanner on the chat as well. So, doctors, in the meantime,
This,
do you all
this,
have any
this can be
questions?
used by all doctors. This can be
Yeah,
used by all doctors.
this can be used by all doctors. Once the payment is done, you can just share me the screenshot so I can go ahead and activate your account as
Derek,
well.
please put your number on the chat as well
I'm
for
doing
them,
that.
please.
I'm doing that. I was just typing that itself. Doctors, I'm also mentioning the scan packs over here just in case you want to choose it. I've mentioned the scan packs also as well in the chat, just in case you want to make a choice or selection. Doctor, it works on Phone Pay and Google Pay as well. Let me try it myself. Yeah, it's working, doctor. Probably if you can use Google Pay or something else instead of Phone Pay. I don't know, should this, or do you want me to send you the link as well? Yeah, doctor, I've also shared the payment link just in case. Okay, doctors, I have put in my details. We'll call this session off right now. And I will send you another payment link. Just a second. What will be the pack that you would like to take, doctor? Would it be a 10,000 scan pack or a 50 scan pack? 100. Okay. Thank you, doctor. Dr. Ashok, thank you for your payment and thank you for trusting in us. You can please send me a screenshot as well on my number and I will contact you in a while. Thank you so much. And for the other doctors as well, we will contact you or all my numbers are mentioned there. Yes, sure, doctor. I will arrange a call and on this, I will arrange everything for you, doctor.